Good morning. I think you're a little bit early. However, we can make a start. So, if I understand correctly, you're here for the training session for tour operators going to the holy city of Jerusalem. Correct? Great. Now, my name is Dr. Hallaneborn Braun Stachen von Munchen. Yes, it is rather long. Yes, I can repeat that. Dr. Hallaneborn Braun Stachen von Munchen. Don't worry, you can just call me Dr. Hallaneborn Braun Stachen von Munchen. I'm an expert in Jerusalem syndrome, and we now feel it's very important that all tour operators travelling to the Holy City are aware of this syndrome and can identify the signs in the tourists and the pilgrims who travel with them. So by the end of this session, you should have a clear understanding of what Jerusalem syndrome is. You'll know its symptoms, the types of treatment we use for people who are suffering, and where they can be treated. You'll be able to intervene if any of the tourists in your group exhibit signs of these disorders. Okay, how does that sound? Great. Do you know anything about the syndrome already? Okay, well, let's begin with Jerusalem, the city. It's a city steeped in history, in religion, and in religious ideas. But also the modern reality of Jerusalem is in sharp contrast to the ideals that we read about in our holy books. So, as they say in this journal, the British Journal of Psychiatry, the dream of Jerusalem is not the same as the modern, politically controversial Jerusalem. So, since 1980, there have been increasing numbers of tourists identified as suffering from psychotic decompensation when visiting Jerusalem. In fact, there are about 100 tourists every year suffering from Jerusalem syndrome, or who exhibit symptoms during their journey, and 40 of them require admission to hospital. And you should probably write this down, there's one central facility for dealing with all such cases, and that's the Kfar Shaul Mental Health Center. The Kfar Shaul Mental Health Center. Yes, of course, it's KFARSHAUL Kfar Shaul Mental Health Center. And this is the place where they can receive psychological counselling, psychiatric intervention, and potentially be admitted to hospital. So over the period 1980 to 1993, there were 1,200 tourists with severe Jerusalem-generated mental problems. Okay, I'm sure you want to know more about the condition, so let me start with a historical case. The Russian writer Gogol was deeply religious, like many other people in Russia at that time, and, as was very popular, believed that a pilgrimage to the Holy Land was of deep personal importance. So in 1848, Gogol was severely unhappy. Despite commercial and critical success, he was having a profound spiritual crisis. It's in sharp contrast with his stories, which are darkly comedic. To begin with, he had a very severe and prolonged case of writer's block. Like with many Russians at that time, he'd been religious for a long time, and he began to believe that the reason his creativity had declined was a punishment from God for the wickedness of his writing. What's that? Okay, his writing, he did kind of surreal, comedic satire. He was someone who has introduced absurd elements. One of his most famous stories is called The Nose, about a nose that poses as a civil servant and steals somebody's identity. Yeah, so very, very surreal, quite different from the Russian literature that is popular these days. Anyhow, as his depression got deeper, he began to believe that the only way to repent and be atoned for his sins and to become talented again was to make a pilgrimage from Russia to Jerusalem. So one midwinter, he travelled across Russia, set sailed, and arrived in Jerusalem by donkey in the February. And he was incredibly shocked by the city. He was expecting the paradise on earth that he'd read about, but the Jerusalem he saw was dirty and inhospitable. There were beggars and touts and people trying to make money. Prostitution, yes. And he could not find the spiritual nourishment that he had hoped for. He was deeply underwhelmed, and the dry countryside, which had very few plants, made his depression worse. And he commented that sitting in Nazareth, as it poured with rain, was no more spiritually moving than sitting and waiting for a train back in Russia. So he came home utterly dejected. However, Jerusalem stayed in his mind, and his religious mania got stronger. And he began to be influenced by a religious group called the Starets, who were kind of charismatic, self-elected religious body, who acted as teachers and advisors. And he decided to fast, which was quite common. However, he fasted during Maslenitsa, and that's usually a week in which Russians prepare themselves to fast by eating more, to fat themselves up in advance. But he was obsessed with food. He couldn't hold out, and he when he broke his fast, his physical and mental state deteriorated. He was prescribed leeches and boiling baths, and the treatment didn't help, and the writer died at the age of 42. And his name is often connected with Jerusalem syndrome. However, the syndrome hadn't been identified at that point, and he never had a modern psychological analysis. So it begs the question, it raises the question, did he have Jerusalem syndrome? So let's pause there. I'm going to ask you a few questions about what we've learnt so far. You can refer to your notes. How many tourists are seen annually for Jerusalem syndrome? How many? Correct, 100. And of those 100, How many require hospital admission? Great, 40, that's correct. Where can you send, or where can you refer tourists who are showing signs of the syndrome? Well, I know you wrote this one down. Yeah, that's right, the Kfar Shal Mental Health Center. And what was the name of the writer from Russia who's often connected with the syndrome? Good goal, good. And last question, what was the trigger on visiting Jerusalem that worsened his depression? That's right. The Jerusalem he imagined didn't match the harsh reality of the Jerusalem he saw when he went there. Now, let's look at the actual clinical syndrome. Now, Jerusalem syndrome is divided into 3 types. There's type 1, type 2, and type 3. Type 3 is what we're going to start with, because that's often seen as the pure or the classic Jerusalem syndrome. And it's also probably the most relevant to tour operators like yourself. So, type 3 Jerusalem syndrome is a discrete form of Jerusalem syndrome, and it's not affected by previous psychopathology. Okay, yes, that sounds confusing. So let me tell you more about it. So type 3 Jerusalem syndrome describes people who have no history of mental illness, but when they visit Jerusalem, they fall victim to a psychotic episode. However, they recover fairly spontaneously and quickly, and then, after leaving Jerusalem and leaving the country, they seem to enjoy normality again. So, type 3 is not connected to any previous mental health issues or psychopathologies, and it's sometimes described as pure or unconfounded form of Jerusalem syndrome. Now, it's quite rare comparatively to the other types, but as a tour operator you must be aware of it. Between 1980 and 1993 there were 42 cases, and we identify these cases using 3 diagnostic criteria. Okay, how many? Yeah, that's right, 3. Just checking that you're listening. So I'll be testing you on this. The first criteria: the person has no previous history of psychiatric illness, no history of psychotic episodes, that's having a very short burst of a mental health issue that disappears quickly, no notable or significant problems at work or family, and no drug use. So, in summary, they can be defined as healthy and mentally healthy and devoid of any mental disorder. So that's the first criterion. No previous psychotic episodes, no notable problems in work or family, and no drug use. Okay, so let's say they meet this criteria. The second is that they arrive in Jerusalem as regular tourists. They haven't come with a special mission or specific purpose in mind. So if one of your tourists, one of your clients, has already told you that they have a religious mission to complete when they come to Jerusalem, they may be suffering from a different type. These are people who come with no preconceived notion of having a mission or purpose in Jerusalem, other than that of a regular tourist. They might arrive with friends or family members, or part of a larger group. And the third criteria is that when they arrive in Jerusalem, they have an acute acute, that means very strong, psychotic reaction. And that reaction has 7 identifiable clinical stages. So, we've got 3 criteria, and now here are the 7 stages. Stage 1, anxiety, agitation, nervousness and tension, or other unspecified reactions. So it's an emotional reaction. So if you notice that your clients, your tourists, if any of them are showing these signs, try and work out if there's an external cause or if it could be this syndrome. A second point is that they show a desire to split away from the group or their family and to tour Jerusalem alone. So as a tour guide, you need to be aware, and at this point you can refer the tourist for psychiatric evaluation to preempt the later stages. If you don't, then they may go on to the next 5 stages. So stage 1 and stage 2, these are the key ones for you as a tour operator. But let's say you don't refer them at that point. What happens next? Well, thirdly, they show a desire to be clean and pure. They become obsessed with baths and showers, and maybe compulsively cutting their fingernails and toenails. After that, stage 4, they prepare a long ankle-length, toga-like white gown. Yes, that's very specific. So it's a long ankle-length, toga-like gown that's always white. That's a good question. Where do they get a long toga-like gown? Often it's just hotel bed linen. They take a sheet from the hotel and they fashion a white gown. You want to know why it's always the same gown? Well, think of the religious imagery that you get in Christianity and also maybe in Judaism and in some sects of Islam. This long gown, white gown, is associated not only with the Middle East, but also with prophets, with the Messiah, with saints and martyrs. And white is a symbol of purity. So this gown is the tourist showing self-identification with these types of figures. Okay, let's move on. The 5th stage, they need to scream or shout or sing out psalms. Like religious songs or poems, verses from the Bible, religious hymns or spirituals. So if you see a tourist who left your group and they're shouting out songs or verses in the street, that's a clear sign, particularly if they're wearing the white gown. This is generally a warning to hotel staff and tourist guides, so you really have to take them for professional treatment or enlist help in doing so. If not, we get the last 2 stages. Stage 6, they generally have a procession or march to one of Jerusalem's holy places. So maybe they go to the Temple Mount, for example. They could try and enlist people to follow them, or they may hold something in their hands like a palm leaf to as a kind of as a flag almost as they march. And finally, they usually deliver a sermon in a holy place, so they preach to the people there. This sermon's usually very confused. It's often an unrealistic plea to humankind to adopt a more wholesome, moral and simple way of life. But it's kind of often quite rambling and inconsistent. So these are the 7 stages. So how do we treat this? Well, they don't really have any hallucinations. They know who they are. They don't claim to be anyone else. But they do ask not to be disturbed in the completion of their mission. And usually the condition returns to normal within 5 to 7 days. So it's generally a short-lived episode followed by complete recovery. They clearly need treatment and they often receive it, but the recovery is actually quite spontaneous and not always due to the treatment. However, the recovery is facilitated or sometimes dependent on removing the person from Jerusalem and its holy places. So being in the city, being near those holy places, can make the situation worse. So the main treatment strategy we have is to support the person being returned to the group or to reconnect them with a family. Sometimes give access to a religious leader. Crisis intervention psychotherapy is a really important part of the syndrome. In a moment I'll give you an example of somebody who had this, but let me ask you some questions first. There are 3 diagnostic criteria for this syndrome. What's the first one? Yes, no previous history of psychiatric illness, work or family problems or drug use. Well remembered and very articulately expressed. Second, correct. They arrive as regular tourists. They have no mission in mind. And thirdly, yes, it's a 7-stage psychotic reaction. Okay, how many stages before a tour guide should intervene? Well done, yes. After the 2nd stage, it's the ideal time to intervene. And the first stages? Great. Anxiety, agitation, and then? Correct. They state that they want to get away from the group or the tour or their family and tour alone. So what happens if they're not referred to it for support at this point, for evaluation? Correct. Purity rituals, dressing up in a white gown, and after that? Yes, screaming or shouting or singing hymns or verses. Okay, and what are the last 2 points? Now, at that point, obviously, they should have been taken for professional treatment, but if they're not? Correct, a procession and a sermon. And then, how do we treat them? Correct, they generally get better, and yeah, that's right, removing them from the city or its holy places. Correct, crisis intervention psychotherapy. You're a very astute student. You're making my job very, very easy. So, let me give you an example, and I'm going to read this from the journal. An example is provided by a Swiss lawyer who arrived in Jerusalem on a group tour of the Middle East, which included 1 week in Greece, 1 week in the Holy City, and 1 week in Egypt. He had been perfectly healthy up to the time of the trip and spent an enjoyable week in Greece. Onset of type 2 of the syndrome was indicated on his first night in Jerusalem. The subject fitted the 3 diagnostic criteria perfectly, and the development of the syndrome followed the 7 characteristic stages faithfully. The whole process took 7 days, after which the syndrome passed. The subject rejoined the tour, enjoyed his visit to Egypt, and returned home in good health. And follow-up indicates that since returning home 6 years ago, the subject has been completely healthy. I know, it's fascinating, isn't it? Yeah, the mind is a strange place. Now, here's a question. is multiple choice. Of the cases looked at, which is the main religious group that suffers from type 3 Jerusalem syndrome? Is it A, Catholics, B, Orthodox, C, Protestants, D, Muslims, or E, Jews? You guessing A, Catholic? Guess again? It's Protestants, yeah. There have been looked at 42 cases, and of these, 40 were Protestants, 1 was Catholic, and 1 was a Jewish man who had lived as a Protestant whilst in hiding during Second World War. Also, of these 40 Protestants, they came from what we describe as ultra-religious families. So these are families in which the Bible is the most important book. The family read it together at least once a week, and it's seen as a source of answers to seemingly insoluble problems, and especially for the father who's head of the family. Yes, so why? Good question. Well, for these people, there's a really high significance placed upon Jerusalem, and they have this idealistic, subconscious image of Jerusalem, the holy places, and the life and death of Jesus, which in the Bible kind of centres around Jerusalem and ends in Jerusalem, culminates in Jerusalem, So a lot of the most holy parts of the life of Jesus, according to the Bible, occur in the city. However, for these people, they seem unable to cope with the reality of Jerusalem today. So there's a gap between the subconscious, idealistic Jerusalem and the city as it appears in reality. So it's been theorized that this psychotic state and the need to preach their message is their attempt to bridge the gap between the two representations of Jerusalem they're faced with. The ideal in their mind, in their subconscious, and the reality in front of them. Okay. We did try to contact the 42 patients who were looked at here. And we only got responses from 4 of them, who just said they felt good and said thank you for the treatment. Nobody answered the questionnaire. And we tried to contact them by telephone interview. Same result. They just stated they were feeling well and did not want to talk about their experience of Jerusalem syndrome. So it's clearly something they're deeply engaged with at the time, but also something that they can't really make sense of, or they just want to avoid later on. But thankfully, our treatment seems to be successful. Okay, so I'm going to talk about some of the other types. These are probably less significant for you as a tour guide, but you never know. It might be important, or it might be something that you can draw on when communicating with your clients, either just as an interesting aside, or to explain something that they might see during the tour. So, the first subtype is a psychiatric religious ideation and need to accomplish a mission. And it usually happens in people who travel alone. And they're people with a psychiatric history, with schizophrenia or bipolar, so they don't fit the type 3 that we discussed. And one of the most famous types of this syndrome is people who identify with the biblical character, and they're convinced that they are the character from the Bible. Usually a man identifies with a male character, a woman identifies with a female character. Let me give you an example. I find this story absolutely fascinating. So an American tourist in his 40s, suffering from paranoid schizophrenia. He had been admitted to hospital and treated over the years in the USA. During his recovery, as part of a rehabilitation program, he began working out. He wanted to improve his body image. He did exercising and weightlifting. However, over time, he started to identify with the biblical character Samson. You're not aware of Samson? Okay, well, Samson's almost like a Hercules-type character in the Bible, a man of incredible strength. Yes, he was like a hero to the ancient Hebrews. So he was overcome by a compulsion to come to Israel, and he thought he needed to move one of the giant stone blocks forming the Western Wall, or the Wailing Wall. Yes, the last remaining piece of the old temple. In his opinion, this block was not in the right place. So he arrived at the Western Wall and he attempted to move one of the stones. When he did this, his actions instigated a terrible commotion among the pilgrims visiting, and it culminated in police intervention, and he was placed in the hospital of, yes, correct, Kfar Shaul Mental Health Center. Yes, where they're all treated. So, despite it not being accepted practice, the duty psychiatrist decided to challenge the patient's delusion. He told him, "You could not possibly be Samson, because, according to the Bible, Samson had never been in Jerusalem." And the patient reacted to this with absolute rage. He became aggressive, he broke a window and escaped through it. And a team was sent out to look for him. Eventually, a student nurse found him standing at a bus stop, and very wisely, demonstrating commendable wisdom, she told him that he had proved that he possessed qualities similar to Samson's, and that he could now return to the hospital, and he did so of his own volition. Yes, it was so fortunate that she was there and able to do that. A hospital examination showed him to be in an acute psychotic state. He was convinced that he was Samson and that he had a mission to accomplish. After receiving antipsychotic medication, he calmed down, and he was flown back home, escorted by his father. Yes, so you may come across people in Jerusalem convinced that they are Jesus, Abraham, in this case Samson. It may be offensive to some of the people travelling with you, whether Jewish, Christian or Muslim. If they're religious, they may find it blasphemous that a person's pretending to be a holy person. So knowing about this syndrome and being able to explain it could be very useful. A second type is people who are, also have a past psychiatric history, but they don't think they're a character. They identify with an idea, and it can be a religious idea or one of a political nature, and they decide to arrive in Jerusalem to act on this idea. Yes, and yes, we know Jerusalem is a very politically volatile place. That's why you'll also be receiving training on safety and security. And yeah, these kind of actions could really be a catalyst for bigger problems. I have an example for this. A Protestant from South America conceived a plan to destroy Islamic holy places in order to replace them with Jewish holy places. Yes, yeah. So the second stage of his plan was then to destroy them in order to start the war of Gog and Magog, so that the Antichrist would reveal himself, after which Christ would reappear. Okay, so yes, these characters, Gog, Magog, the Antichrist, these appear in Christianity and in Islam, and it's seen as signs of the ends of days before the final judgment. In Christianity, it's from the Book of Revelation. It's a very poetic text, but it's often seized upon by people with mental health issues who take aspects of it literally, or try to accelerate the signs of the end of days and to bring on the kingdom of heaven. Okay, so what happened? So this South American patient, he succeeded in gutting one of the most holy mosques in Jerusalem. Yes, so he had a psychiatric examination which was ordered by the court. So he was facing criminal charges, but he was diagnosed as being unable to differentiate between right and wrong, and because of his mental illness, not responsible for his deeds, and therefore not fit to stand trial. He was admitted to a local psychiatric institution and later transferred to a mental health institution in his own country. Yeah, you can imagine how bad that situation was, but also how bad it could have been. And it was also kind of avoidable. If people were more aware of this syndrome, it wouldn't have got to that point. Okay, so we've talked about type 1. There's a third type, which is magical ideas connecting health and holy places. So often people who are sick and expect Jerusalem to heal them. This is the one which is often associated with the story of Gogol. Yes, the one we talked about at the beginning. He travelled to Jerusalem to be healed, but sadly it didn't have the effect he wanted. And the fourth subtype is related to people with family problems, and it leads to a psychosis in Jerusalem. Yes. So often these people will have some issue back home, and visiting Jerusalem is a form of escape. Okay, I'm not going to go into type 3 and type 4 too much. So let's do a quick test on type 1. So what makes type 1 different from type 3? Correct. Past history of mental health disorders. And type 1 patients, what is unique about these ones? Yes, identification with biblical characters, that they feel they are biblical characters, correct. Yes, and they need to accomplish some kind of mission. Do they travel in groups or alone? Yeah, usually alone, as with other subtype 1s. And how is subtype 2 different? Correct, it's centered on an idea, and they arrive in Jerusalem to act on this idea or mission. Yes, and the example from subtype 2, what action did the patient take before he was taken in for psychiatric examination? Yes, he was destroying the contents of a holy site. Okay, and very briefly, subtype 3 and 4. Yeah, subtype 3 relates to magical ideas of healing. Subtype 4 is related to family problems. Okay, and lastly we have type 2. And these are people who come to Jerusalem out of curiosity. They don't have psychotic behaviour, but they have strange thoughts or missions. These are usually personality disorders rather than severe psychiatric episodes. And there's two subtypes, groups and individuals. So subtype 2 people may have personality disorders, obsessions with a fixed idea, but not a clear mental illness. And subtype 1 are the groups. And there are some Christian and Jewish groups who are classified as subtype 2, living in Jerusalem. The Christian groups are usually outside the mainstream of the established church, so they may be a Protestant subsect, and they move to Jerusalem and settle down, often with the intention to bring about the resurrection of the dead or the reappearance of Jesus Christ. Yes, related to the bringing on the final judgment. Generally, there's 20 or less people. I can tell you about one group, yeah? There's a group who are now, they used to be in Jerusalem, now they've settled near Jericho. And there's one in the Jerusalem forest and one in the centre of Jerusalem. And they wear distinctive clothing that they claim is similar to the clothes worn in the days of Christ. Yeah, and there's Jewish groups as well. And they often have unusual ideas or inventions related to Jerusalem. 3 groups are attempting to create a red heifer. Yes, a heifer like a cow. And this is based on something in the Old Testament, in the book of Numbers. So the red heifer, or the red cow, was to be sacrificed, and its ashes used for purification rituals before entering the ancient temple. They believe that today, touching the red heifer would be enough, because the temple was destroyed. And the problem is that it's, as of yet, there has not been a perfect, unblemished, completely red heifer. And these groups don't generally have psychiatric examination because they don't cause problems or endanger others or even break the law. Only 3 people from these groups have been examined, and that was because of angry confrontations or violent confrontations with their neighbours. And in those cases, they were all diagnosed as suffering from personality disorders. So that there may be a chance that you go past the places where these people are settled, or you see them around in Jerusalem or the surrounding areas, and you may want to be able to explain what they're doing to your groups, but it's unlikely that any of your tourists will be of these groups. And finally, of this subtype, you get lone individuals travelling with these idiosyncratic ideas. One example is a man from Germany, age 45. He worked in academia and he was considered healthy. He had no recognisable problems. But he was obsessed, and could not explain why, with the need to find the true religion. And he spent 5 years studying the various types of Christianity and esoteric religions of Persia, China and Japan. And he decided that none of them could be described as the true religion. He then took a sabbatical from work. He came to Jerusalem and he started studying Judaism at a university near Jerusalem and in a religious seminary called a yeshiva. However, he also rejected Judaism. Finally, he decided the only true religion was something he called primitive Christianity. And he felt that was the religion of Jesus before it was ruined, in his words, by the apostles Peter and Paul. And he felt a mission to bring this message to the people of Jerusalem. And he was preaching it to every opportunity. And then one day he had an attack of agitation, started shouting at the priests. He accused them of being pagans and barbarians and worshipping graven images. And it developed into a violent struggle. And he started to destroy statues and paintings. So he was ordered to enter the Kvarschau Mental Health Center, where he was observed and evaluated. However, this revealed no psychopathology, not even a mild personality disorder. All they could find was an obsession with the fixed ideas we've described. 3 years later, following up with him, they failed to indicate mental disorder. He continues to work in academia, continues to believe in the same religion, continues to spread his message. He only regrets that he's unable to do this in Jerusalem. Okay, so we've talked about type 1 and type 3. What about type 2? What's the difference between the two subtypes? Yes, the first is about groups, often residential groups, and the second is about individuals. And what makes this different from type 1 or type 3? Yeah, it's a fixed idea. It's not a short episode, that's correct. It's a long-term fixed idea. And what's the difference with type 1? Yeah, they don't have a history of mental health issues, only personality disorder. If that, either personality disorder or an obsession, correct? Okay, yeah, the examples are fascinating. So, at the beginning I said you'd understand what Jerusalem syndrome is. Do you feel you've achieved that aim? Okay, how would you explain it? Yes, it's a type of psychotic reaction or mental health issue related to the holy city and visiting it. How many subtypes are there? Okay, and as a tour operator, which one do you think is the most important to know about? Yes, type 3. And how can you help prevent issues with people who have type 3? Yes, intervene after signs of agitation, anxiety, wanting to separate from the group. And are there any which you think will be important to explain to your clients? Yes, explaining the behaviour of people with type 1, that could be very important, especially if you've got religious pilgrims travelling with you. Okay, and which of the examples did you think was the most interesting? The one about the guy who thought he was Samson. Yes, when you're in a mentally healthy state, it's quite difficult to imagine how you can believe that you're a biblical character. It's amazing what the mind can do. And where should you refer people to for treatment or counselling? That's correct. Well, thank you so much for your time today. Yes, I've been Dr. Hallaneborn, Braun, Stachen von Munchen. Yes, if you have any queries related to the condition, please let me know. We'll be sending you a link to an online exam, and all the questions relate to points that we've mentioned during this session. I can see you've been taking extensive notes. You need to pass with a score of 70% or higher, and you must get correct the question about when to refer people and the centre where they can be treated. Yes, you'll be receiving that test within the next 2 days. Okay, thank you so much for your focus, your hard work, and your interest. Lovely to meet you. Have a nice day.